What are the rules for cross-state telehealth patient location? Imagine trying to see a doctor from your living room, but suddenly the rules about where you are matter more than you think. That's what navigating cross-state telehealth is all about. When you have a telehealth appointment, the main rule is that the care is considered to be delivered where you are physically located during the visit. So, if you are in State A, the healthcare provider must be licensed in State A to legally provide services. This means providers need a valid license for the state where the patient is at the time of the appointment, not just where the provider is based. During the COVID-19 public health emergency, many restrictions were relaxed. Patients could receive telehealth services from almost anywhere, including their homes, without worrying about state borders. But starting October 1, 2025, most of these temporary rules will go back to how they were before the pandemic. That means for most services, patients need to be at an approved originating site to qualify for telehealth. These sites include hospitals, clinics, federally qualified health centers, rural health clinics, and skilled nursing facilities. However, for mental health and substance use disorder treatments, patients can still receive care from their homes without worrying about where they are. This makes mental health teletherapy more accessible for many people. Providers also need to be credentialed at the facility where they are practicing, which can be done through traditional credentialing or through credentialing by proxy. Credentialing by proxy is especially useful when providers are practicing across state lines, like in rural areas. Some states have special rules or licenses that allow out-of-state providers to give telehealth care without full licensure. These are often temporary or emergency licenses, especially for providers from neighboring states. Federal programs for veterans also allow providers to deliver care across state lines, regardless of state licensure laws. When setting up a telehealth appointment, it is important to verify the patient's location at the time of the visit. The platform used should be able to document where the patient is during the appointment. This helps ensure compliance with state laws and billing rules. If you are a provider, check your licensure status for the patient's location before the appointment. For patients, always confirm your location when scheduling or starting your telehealth visit. In summary, the key rule is that telehealth services are delivered where the patient is physically located. Providers must be licensed in that state or use applicable exceptions. Telehealth platforms should support capturing patient location data. Knowing these rules helps keep your telehealth visits legal, reimbursable, and safe. Whether you are a patient or a provider, understanding these guidelines makes navigating cross-state telehealth much easier and smoother.